Hello, my name is Christoph Ritter and I'm a professor of clinical pharmacy at the University of Greifswald, Germany. And I would like to answer the question today, should we be mindful of drug interactions between alternative medicines and graft versus host disease treatments? Well, alternative medicines span a wide spectrum of different products. And it is particularly the herbal preparations that possess a risk to interfere with graft versus host disease treatments. And this is mainly due to an interference with systems that metabolize or transport drugs for graft versus host disease treatments. In particular, the metabolizing enzyme cytochrome P453A4 and the transport protein P-glycoprotein are involved in the metabolism and excretion of a number of these graft versus host disease treatment drugs. And these drugs include cyclosporine, tacrolimus, sirolimus, everolimus, as well as the glucocorticoid dexamethasone. And the herbal preparation that is most known to interfere with these enzymes and transporter certainly is St. John's wort. And this interaction, this herb-drug interaction, is pretty well, the evidence is pretty good, the clinical evidence for St. John's wort. But however, it also depends on the content of the ingredient hyperforin that is mainly attributed to be responsible for this herb-drug interaction. But there are also other herbal preparations that may possess a risk for herb-drug interactions with these graft versus host disease drugs. And these include the Indian frankincense, boswellia, Korean ginseng, milk thistle, and purple coneflower. And the evidence is based on partly preclinical investigations, but also based on clinical trials. Many of these herbal preparations, however, several clinical trials have been investigated that show divergent results, which reduces the grading of the risk a bit. There are other graft versus host disease drugs, such as methotrexate or mycophenolic acid, that are preferentially taken up or excreted by drug transporters. And that's the reason why the drug interaction risk is somewhat different to the other graft versus host disease drugs. And in particular for the transporters, another herbal preparation comes into place, which is sage. And also for sage preparations, there is some evidence that these preparations may interfere with the respective drug transporters. And finally, there's cyclophosphamide, which is metabolized by the cytochrome P450-2B6, which is a less known enzyme and also less investigated enzyme. And that's the reason why for cyclophosphamide it's very difficult to estimate herb-drug interaction risks due to this to the lack of investigations that we have here. So well, I guess to answer the questions whether we should be mindful of drug interactions between alternative medicines and graft versus host disease treatments, I guess the answer is yes. There are some herbal preparations that have a relevant risk to interact with some of the graft versus host disease treatment drugs. However, one has to always keep in mind when talking about herb-drug interactions that there is a high variability between and among herbal products, which makes a general assumption difficult and always requires an individual assessment of herb-drug interactions. Thanks.